For those that don't know me, I am Carol Gelbard, and I am the Emotional Wellness Director at NDF. As a mental health professional, I am always interested in learning new ways in which we can support patients, their loved ones, and the GNE myopathy community. I'm very excited to be able to introduce our presenter, Dr. Sepideh Tabibian. I had the pleasure of working with her as a fellow board member at NDF. Being a medical doctor and a GNE myopathy patient, she has a unique perspective to be able to share her medical expertise as well as her personal experience to help other patients learn to incorporate lifestyle changes to help them cope more effectively with their disease. Dr. Sepideh Tabibian earned her bachelor's degree from the University of California, Los Angeles. Woohoo! I also went there. Her medical degree from the University of Health Sciences, and she subsequently trained in the family medicine at University of Southern California. For over a 10-year period, she served as an NDF board member, and she's been a GNE myopathy patient for the past 23 years. She's been an active presenter in our previous patient days, speaker series, and patient huddles. She has a focus on holistic medicine and truly embodies the mind-body approach in managing her disease. As many of you probably already know, there's a wealth of research and studies that show that the mind-body connection can be instrumental in reducing symptoms associated with various diseases. So please come listen with an open mind, and you never know, you might learn some new tips to help you. The best endorsement is Dr. Tabibian feels her slow progression of her disease can be attributed to her healthy mindset in which she incorporates diet, movement, and meditative practices into her daily routine. I'm always interested and excited to hear what she has to offer, and I hope that you'll find her information valuable, useful, and practical. Before I turn it over to Dr. Tabibian, I want to let everybody know that she'll be presenting for about 45 minutes. Please use the chat box to engage with other people. However, I would like people to put questions in the Q&A that we will get to at the end of her presentation. I am fine with people putting questions as they come up while she's speaking, because it's good to keep that in the Q&A, and I will get to them at the conclusion of her presentation. So now I will finally turn it over to Dr. Tabibian. And again, we're very excited to hear what you have to offer. And thank you again. And thank you all for attending and being here today.
Thank you, Carol, for your lovely introduction. Hello, everybody. Thank you for tuning in. So as she said, today I'm going to talk about mindfulness and holistic medicine for us GNEM patients. Obviously, these are the steps, techniques that I've used myself, and I want to share them with you. They're also part of my book that I'm writing for the helping people with chronic health issues. So I hope you enjoy and you learn some helpful techniques. All right, so basically, it is important to use mindfulness techniques, and which include working on body, mind, and spirit, to help improve our day-to-day lives. For us, especially that dealing with the chronic health issue is really important. And I know a lot of people are waiting for research or any type of medication to help them with their disease with GNEM. But meanwhile, we can focus on our body and our health ourselves. We can do stuff to help our body so we can live a better and healthier and happier life. So I'm going to talk about emotions, nutrition, exercise, and meditation. First, I want to talk about emotions. Obviously, for myself personally, and I'm sure for a lot of you, when you first heard about your diagnosis, it was very devastating. There's some people who were misdiagnosed for many years until they found that they have GNEM myopathy. And that's very important that first you kind of be, taking care of your emotions. And the first normal human reaction to hearing such news is to be upset, devastated, fearful, hopeless, and all of that is important. And that's basically part of grieving process that everybody goes through. And that's a normal process. And it's kind of not normal if you hear the news and you don't have any reaction. It might take a while, but there are 5 stages of grief that everybody goes through when they hear any type of bad news. And that basically is denial, anger, bargaining, depression, and acceptance. My goal is to help you to get to acceptance as soon as possible. And it's different for every individual. For some people, it takes shorter time for them to accept the process, their diagnosis. For some people, it takes longer. But the key point is once you get to the acceptance, that's when you have the chance to working on your healing process. That's when you see results. Because unless you're still going through denial and anger and all of that, you're not able to work on your health, and you're so overwhelmed by all these emotions, then there's no room for you to kind of want to get out of it. But our purpose is to go through the emotions and get to the acceptance, and that when you can work on your health, yourself and your healing process. And in order for you to heal, you need to work on body, mind, and spirit. You can't just work on the body and have horrible, mental status and feeling really bad and sad and upset. So that doesn't help. So the 3 keys like body, mind, spirit. And that's why I want to get through some of them today with you guys. So for working on the body, obviously, first thing is nutrition. Nutrition is very important. What we put in our body, it basically determines how we feel and how our health is going to be. There are 2 concepts about nutrition I want to talk about today. One is like the pH of the food that we eat, which is if the food is acidic, if the food makes your body acidic, or if the food makes your body basic. When body is acidic, it's more prone to illness and disease. And where your body is alkalinized or it's basic, that's when it's considered protective. That's in fact, there was a patient with cancer a while ago. It's about 20 years ago. It was a terminal illness, and like a few weeks before he passed away, we checked his urine. It was completely acidic. So when your body is acidic, it's an environment ready for disease. So by changing your pH of your body, by consuming foods that is more of the basic, that's when you kind of guarantee that your body is going to the right direction as far as like healing itself. I can show you a diagram here. On the right, you see in the middle, those are the numbers of the pH. So our body is neutral pH, which is around 7.3 to 7.4. That's considered neutral. From number 7 to 14, the more you go towards 14, the more basic your body becomes or environment becomes. And from 7 to 0, if you go down, your body becomes more acidic. So what are the basic foods? The food that make your body alkalinized are the ones on the right. So any type of like vegetables, green leafy vegetables and fruits, such as beet, cauliflower, kale, spinach, apple, avocado, dried figs, lemon limes. These are the good, healthy food that not only are healthy for you, but they also make your body alkalinized. One trick is in the morning, if you wake up before having any breakfast, just fill a glass of water, regular temperature, and just use like lemon juice, fresh squeezed lemon juice in it. And once you drink that, it actually makes your body basic. So that's how you can start off your morning with. And then be mindful of what you put in your body. So on the left side of the spectrum are the food that are acid-forming foods. So there are hamburgers, hot dogs, basically meat, special red meat and white meat. They make your body more acidic. And then you go towards candies, cookies, sugar, alcohol, soda. So everything that, most of the food that has a lot of sugar in it makes your body more acidic. So the key is here for balance, to have a balance. Obviously, you want to have soda here once in a while, you're going to have meat. That's also good, but it has to be a balance. So in your plate, you want to have more vegetables than like meat. And then you got to be mindful, like having more green leafy vegetables and having rainbow colors on your plate, meaning like using the vegetables are green or yellow or red and all of that. That makes your, and then in the beginning it might be hard for you, but as you go on and you change your diet, it kind of becomes, it's not sort of a diet, it's more like a life, it's a change of life system. So you basically get used to it. It's not about diet anymore. It's you focus on your health, and that's what's going to be helpful for you. It's basically lifestyle change. That was the word I was looking for. So the second part about nutrition is inflammation and consuming anti-inflammatory food. So what is inflammation? You know, if you notice, if you injure your arm and leg or anything, you immediately see that your that area is swollen, is red, is warm and tender to touch. That's part of inflammation. That's inflammation happens basically when body is invaded by toxins, chemicals, infections, so on and so forth, which through a process of hormones and everything else, it stimulates the immune system to react and to kind of repair that damage that was done in the body. Acute inflammation, it's very helpful. It saves our lives. But the problem lies is the chronic inflammation. And when your body is in constant inflammatory process, it basically, it has a definitely negative impact on your tissues, on your cells, and it creates an environment for disease to happen. And unfortunately, inflammation is the biggest problem right now in the United States, and I'm sure in all over the world. And the problem is some people don't even have, they don't even know that they have inflammation in their body. And then later on leads to a lot of diseases, a lot of health issues. There's some signs of chronic inflammation, which include like when you have brain fog, you can't concentrate well, you forget things, when you have weight gain, unnecessary weight gain without any reason, or you have chronic aches and pains in your body and you don't know where it's coming from, you haven't had any injury, when your energy is really low that you can't get out of the bed, or you have hard time, trouble sleeping. So these are the signs, watch out for these signs. It doesn't mean if you have one of them, one or two, you have chronic inflammation. But if you notice, if you kind of, you know, experiencing a lot of these signs and you don't have a good reason behind it, you might want to think about chronic inflammation, and what you can do is changing your diet. You can go online and, you know, you can search and they can give you all the whole list of foods that are make your body basic or alkalized, and then also the waters that they sell, the water bottles that they make your body more basic. But the best trick for me is like having the lemon water in the morning. And the anti-inflammatory diet is basically the key to a healthy body. So basically, eating stuff that is more basic and eating the anti-inflammatory diet is a crucial point in keeping up with your, you know, health as far as nutrition. And looking again, this chart on the left side talks about the food that fights inflammation. You can see it's tomatoes, fruits, which like berries, strawberries, blueberries, cherries, and then oranges, and then nuts, some nuts, walnuts, almonds, so on and so forth, and olive oil, and then leafy green vegetables, spinach, kale, collard green, and then fatty fish, like salmon, tuna, sardines. These are some type of food that is anti-inflammatory. Personally, also what I do in the morning, I make my own tea, which is like anti-inflammatory tea, and that's consistent of cinnamon stick, fresh ginger. You can also add lemon in it, or if you want, you can also add turmeric. And then for taste, you can add a little bit honey. So that you just mix all of it, you add water and let it simmer. And that, if you drink it every day, that's like a good source of anti-inflammatory drink. Instead of like coffee or tea, this would be a very great replacement. And as I said, you can just, you know, add different things if you want, like rose. Some people add rose to it. That also has a lot of good anti-inflammatory process in it. So, and then the bottom, there are foods that basically it's opposite and make your body more basically acidic. So there are fast foods, sodas, refined carbohydrates, lard, processed foods. So basically you want to stay away from processed food and sugars and fast foods and kind of go to whole foods and more green foods. So you need to have colors in your plate as far as to keep your body healthy. And also the other part is to add vitamins and supplements in your diet. What happens is because of our diet these days, we are not getting enough vitamins and minerals through our diet. I mean, you have to have tons of like vegetables, green vegetables to get enough vitamins and minerals that your body needs. So for that purpose, it's easier obviously to add supplements and vitamins to your diet on a daily basis. Personally, I take multivitamins in a liquid form. It's kind of like easier to digest, and it actually works faster for me. Obviously not everybody prefers that, whatever you're comfortable with, but as long as you take your vitamins on daily, that's important. The two vitamins that are very important are vitamin C and D. As you know, with the recent pandemic that we've had, we've kind of noticed that these are very important because it helps our immune system fight diseases. And unfortunately, a lot of us, we don't get enough vitamin D because we are not under sun a lot. Your body needs to be under sun maybe 20, 30 minutes a day. But because of that, majority of people are deficient in vitamin D. And when you're deficient in vitamin D, then it makes your body prone to a lot of health issues in the future. So it's better to take the supplement. Also, you can do a blood test to check the vitamin D level in your body, and you can consume it every day. The other one is coenzyme Q10, that I also take that in liquid form, and that's really good for your cardiovascular system. It gives you a lot of energy, and it's really good for you. So the nutshell, it's like, yes, we have a healthy diet, but we have to also supplement, use the vitamins, the supplements, and minerals that we need. And then if you have more vitamins and supplements, that's fine, as long as they don't interact with, some medications. If you're on some medications, that should be okay. Okay, so the other part of the body, working on body, is movement. I would say movement because I don't want the GNE myopathy patients to be discouraged because they cannot go for a run, and for that reason, they don't want to do any exercise. No, any type of movement is important. The key point to that is to be persistent. Meaning, like, I don't want to do exercise 1 week here and then just don't do anything for another month or so and then do another day of that. In fact, you kind of might damage your body more because your body gets stiff and you want to go back to that exercise. It doesn't work for that. So it's important to do persistent. What I would recommend is start 5 minutes a day. And that's, I'm talking about movement. And just work your way up to half an hour a day. If you cannot do it every day, do 3 times a week. But at least do be persistent. So do 3 times a week, every week. And I want you to do the movements, even little movements that you are able to. At the same time, because you cannot do it yourself, I don't want you to don't hesitate to ask for help, basically. I want you to ask for help from your family, friends, or caregivers to help you with the movement. So that way you can just achieve what you want with somebody's help. One thing you can do that's really important, and that's done through yoga or other exercises, is stretching. I've been doing stretching for like over 20 years, and that's through yoga. And what the help that I see from it, once you stretch your muscles, you increase the flow of blood and oxygen to your muscles. So you get more nutrients to your muscles, and they become obviously healthier. At the same time, your body becomes flexible. So in case, God forbid, if you fall or you injure yourself, it's going to be less injury to your muscles because you've been doing stretching all the time, on a daily basis or regular basis. And I have noticed, actually, I've had GNEM for 23 years now, and I've noticed that compared to other patients, I have less aches and pains in my muscles. And I think that the major part of it is because I've been doing stretching on a regular basis. So it's not late. If you haven't done stretching, it's okay. You have to be patient with your body. If you haven't done a lot of, if you're not moving much, you're on a wheelchair, it's just take it slow, and take it slow by slow. Your body is going to respond, and it's going to be easier and easier. In first, your muscles might be very stiff, like especially the muscles in the back of your legs, hamstrings, but slowly you're able to kind of like become more flexible. And it takes time, but you have to be patient and you have to be persistent. The other part that I want you to move is your joints, especially shoulders and hip joints. Because of lack of mobility, the joints become stiff. There's a fluid that inside the joints that causes lubrication of your joints. And if you are not moving, basically it causes pain, it causes difficulty moving, and it's not good for you. So it's easy way to do it is like you can ask for help to do circular movement for your arms, shoulders, your wrists, your ankles, and your hips. And along with stretching of your hips and your body, it's very, very helpful. And as I said, if you can't do it, please seek help and ask somebody to do it. You can easily find stretching exercises online, or in the future, I can just put, some stretching exercises, and we can just post it through NDF website so people can look at it. And just take advantage of those exercises. And the other key for GNEM patients is to do light exercises, but persistent. You don't want to do heavy, excessive exercises, because then once your muscles become too fatigued, it would actually damage your muscles. So you kind of have, you gotta learn the limit of your body. So you want to do it very low impact and very persistent exercises, and do not overdo it. Do not do excessive exercises. And if possible, I would recommend doing it outdoors. You can go to your balcony, backyard, park, whatever, because this way, not only you're enjoying environment, the nature, you have, the flow of oxygen to your body, and then it's better for your mind as well. I mean, some people are comfortable with gym, that's okay too. Depends upon what your body, like situation with your body is. Just do whatever you can. Even if it's like your fingers, your hands, don't give up. That's my point. I don't want you to give up at all. You can still, even if you're bedbound, you can still use, with the help of other people, they can help you and they can move your body and joints. Okay, so now we're going to kind of sort of mind and spirit. This is an important part, especially for GNEM patients, that dealing with such a devastating disease, we often, especially in the beginning, we often get depressed, and we harbor a lot of negative emotions. So, and for everybody else. So, especially when you first find out about your diagnosis, most people get devastated and they have all these fears and negative emotions. They don't know what to do with it. So this happens to all of us, whether we have HIBM or not. We all have bad days, we have negative turbulent emotions, but the key point is how to deal with them and release them. As they say, pain is normal in life, but suffering is not. And we do not know how to deal with pain. When we do not know how to deal with pain, we suffer. So my point is to release the negative emotions, and that would set us free. It's not bad. We have, as human beings, we go through all the emotions like fear, depression, anger, frustration. That's not bad. The problem lies within holding on to these emotions for a long period of time. So if we don't deal properly with our anger and negative emotions, over time basically affects our physical well-being in a negative way. And for example, if you are angry or if you have a lot of fear, some people, if you notice, some people experience heartburn, stomach pain, stomach discomfort, basically GI discomfort. And that is because there is a direct interaction relationship between your emotions and your body. So it's very important as we take care of our body through physical activity and nutrition, we also have to pay attention to our emotional well-being, because you cannot being a healthy person if you just exercise and eat properly while you're angry and dealing with a lot of negative emotions. No, that's actually it's become more destructive. In fact, taking care of your emotions is much more important than anything else. So people would ask, okay, how am I gonna, I don't know how to release my emotions, it's very hard for me. There are different types to do it. There is one way that I've done it in the past. So you just sit down, you kind of become aware of the emotion you're having, whatever it could be, and you just sit down and write about it as much as you can, to the point that you feel like you have nothing else to say. And you can write whatever you want. You can curse, you can whatever you want. There is no judgment and nobody's going to see that letter. So once you finish that letter, you can read it again and add more stuff to it. So once you feel to a point like you kind of release yourself, you don't have any of those emotions in your body, you kind of tear it apart and just burn the paper and just discard the ashes. Like you can flush it down the toilet, just get rid of it. That's sort of, you can release the emotion that way. It might happen 2-3 times that you have to deal with that emotions and do this process few times, but that's okay. The other way is some people, like when they're angry, they want to kind of like get physical. Obviously, it's not safe. It's not the right thing to get physical when you get angry at somebody or something. But you can do it in a safe way. You know, when you're at home, just get a soft pillow and just hit the soft pillow and just yell, scream if it's safe and it's like not bothering anybody. That way you kind of release the emotions. You don't hold it in, because once you release it, then it's gone. It's not going to stay there. The other way is like to talk to a friend, somebody that you can trust, and you talk, or a therapist. Therapist actually is great in this way, because you can talk to, in a safe environment, to a professional, and you can talk about whatever is happening in your life, and that's actually very healthy for you. So also Dr. Deepak Chopra, they gave some ways to deal with emotions. Um, you can, when you have that the emotion, so what you do, you kind of identify it in your, located in your emotion in your body physically. So you can close your eyes so it's easier for you, and you say, okay, what am I feeling? Am I feeling frustration? Am I feeling guilt? Am I feeling anger? Am I feeling depression? So you kind of identify it, and then you kind of locate in your body. Where do I feel this? Is it in my heart? Is it in my chest? Is it in my belly? Is it in my abdomen? Where do I feel it? So you kind of identify that, and then you kind of take yourself back and witness the experience. So let's say I say, okay, I feel anger in my stomach, for example. And then you kind of push, as if you're a third person, watching yourself from outside of your body, and you kind of observe it. You witness the experience without even judging it or without getting involved personally. Once you witness the experience, then you experience the emotion. So you go through the emotion, you feel it, you feel the anger, you stay in it. I assure you, it's not going to take a long time. Maximum minute, couple minutes, maybe less. You go through that experience, and this should be in a safe environment. I don't want you to be, walking with a walker and think about your anger. You want to sit down. You want to be a place that nobody's bothering you, nobody's causing in trouble, and you kind of like go through, experience that emotion. And also through that, you also take responsibility of your emotion. Because if it's somebody else's fault, then we have no control over taking care of the emotion. So the key point that you do not blame it on other people. You take full responsibility of that. And that's when you can change your emotion, you can release the emotion. So the last part is, once you take responsibility, you experience that emotion, then you release it. You let go of it. And then you share the outcome with your friends, whoever you trust, and then celebrate it. This way you get rid of the emotion, and you just feel happy. And obviously we are human beings. We always have emotions. We go through emotions all the time. As I said, emotion is healthy for us, but holding on to it for a long time, that's not healthy. And it's basically, as I said, it's normal to go through unwanted emotions throughout your life, but it's not normal to stay and marinate in negative emotions for long term. And some people for lifetime. They're dying and they're still harboring negativity towards people or towards themselves, and that's not healthy for anybody. All right, so now I want to kind of move towards mind and spirit. And one practice that has helped me personally is meditation. Um, Meditation has been practiced in many cultures and countries. And it's what it is, it's a process of redirecting your thoughts to a uh, calmer mind. So you basically, your thoughts become calmer. You don't have the chatter in your head. And it also, they've done research and scientifically has shown that also reduces blood pressure for people who have high blood pressure. It controls pain with people with chronic pain. It decreases anxiety and stress. It helps with depression. It also improves sleep, your attention span, and overall emotional health. So why not do this exercise? It doesn't require any finances. You don't have to buy anything. Uh, you can do it on your own. You don't need anything, any equipment for it, and you get a lot of benefit out of it. So it's best to practice it daily, usually twice a day in the morning and evening. There are some meditations that they do 20 minutes. That's called TM in the morning and in the evening, but you can start from 5 minutes and work your way up to 20 minutes. You can start once a day and then increase it to twice a day. There are different types of meditation. There's some that use mantras and some they don't. Mantras basically is a word that doesn't have any meaning and you repeat it in your mind. And once you do that, because there's no meaning attached to that word, so your mind, your thought cannot find a picture linked to that word. So that way, your mind starts to relaxing little by little. And, once you do daily practice of meditation, you get the point that once you close your eyes to do meditation, your body goes right through trance. And that's such an enjoyable and wonderful feeling to have. And plus it's very healthy for you. And plus you can concentrate better and you feel a big difference in your health afterwards. So I want to talk about the key takeaway. And what I'm going to do, I'm going to take you through a 7-minute meditation with mantra. And then after that, we can go to question and answers. So negative emotions, basically normal in our life, but the key point is once we hold on to negative emotions, it basically advances our health issues. It's giving you a lot of problems. And having a healthy diet is very important for our body. And healthy diet, what I talked about, obviously there's a lot to talk about, but I talked about consuming more anti-inflammatory diet, consuming more food that make your body basically whole foods, whole vegetables, and whole foods, which is vegetables and the fruits and grains. It's really healthy for your body, and you want to stay away from processed food and sugar and red meat all the time. And persistence is the key when it comes to the exercise and movement. Even if you do it once every week, at least do it every week, once a week. And daily meditation has a lot of benefits to our body and including relaxing the mind. So I want you to kind of get yourself in a comfortable position. I'm going to give you a few minutes. Okay. So I want to tell you about the mantra. So the mantra that I want to talk to you about that you can repeat in this meditation is called Om. This is a universal mantra. So it's OHM, Om. they say it, and it doesn't have any meaning to it. What I want you to do it once you close our eyes, start our meditation, I want you to repeat this mantra in your head, in your mind, not out loud. And it happens that when you start to repeating this, then you get lost in your thoughts and the chatter starts coming to your head. That's okay. I don't want any judgment. I don't want you to judge it. Just witness the thoughts. And then as they go past, you just go focus back on saying your mantra. And this could, especially in the beginning, if you're a beginner in this happens the whole time in the beginning. Your thoughts take over and you kind of forget about your mantra. And that's absolutely normal. And you're still getting the benefit of the meditation. So I don't want you to think that you're not getting the benefit. You just have to be witnessing the thoughts and go back to the repeating the mantra. And as you basically do more meditation, then your body, it's easy for your mind to relax and for the chatter to go away faster. But you just have to be, again, persistent and be patient with it. So now I want you to close your eyes, and I want to start with taking 3 deep breaths, inhaling through your nose and exhaling through your mouth. So let's take a deep inhale. Slowly exhale through your mouth. Another inhale deep. Exhale through your mouth. Last time, inhale through your nose. Exhale through your mouth. Keep your eyes closed and start repeating mantra Om in your head. You don't want to be repeat it out loud. And then if your thought process comes to chatter, I want you to just refocus on your repeating your mantra. No judgment, no anger, no emotions. Just be relaxed about it. Okay, let's start. Okay, so we're gonna end the meditation now. So I want you to take a deep breath, slow inhale, and exhale through your mouth. You can slowly open your eyes. And I'm sure everybody has different experience, but I hope it was a pleasant one. Right now, we can answer, I can answer your questions. So please submit your questions if you have any, and we'll go from there. Okay, Carol.
Well, first of all, I'm so relaxed right now. It was so nice to just take that 7 minutes just to kind of decompress. It's such a good practice to keep in mind. And I think so many of us don't take the time to do it. But when we are in something like this and we're kind of like forced to do it, how relaxing it can be. And actually, that was one of the questions. But before I get to the questions, I want to say a few things. First of all, this was so informative. Every time I listen to you, I learn more tips and suggestions. And I think you have a really nice way of explaining in a very practical way how these suggestions and things to incorporate in your lifestyle can make a difference. And I think you're absolutely right that a lot of people are waiting for a cure and waiting for effective treatment. And in the meantime, how can we help patients learn to live with the disease and live the most fulfilling life they can? And I do think these things make a difference. They are not the magical cure, but they definitely make a difference. And you are a pure example of that. So what I will also say is that you touched on a lot of really important topics. And then we're going to even have additional speakers come in to elaborate. So if you found the nutrition piece really helpful and want to dive deeper into that, we have a nutritionist coming in on August 13th. If the movement piece and the physical exercise, you want to learn more about that, we have a physical therapist and an occupational therapist presenting on August 27th. The mind-body connection and talking about managing your emotions. I'm doing a presentation on July 23rd with Dr. Jen Yashari, talking about managing anxiety during reentry during the post-pandemic world. So I'm so glad you touched on all these things. And again, there will be opportunities to learn more if you found some of these topics intriguing and want to kind of delve deeper into it. So I'm going to go to the Q&A. The first question somebody asked is about how is lemon barley water to alkalize the body?
How does it do it? Well,
Yeah, I think that's how is lemon barley water how is it supposed to alkalize the body?
lemon, because people think lemon because it's sour is acidic. In fact, it's opposite. The combination of the citrus juice in water make it more basic, so it alkalinizes the water. And if you drink it right first thing in the morning, it actually helps your body to become more into it. This is an easy way because they sell a lot of bottles water out there. This is the easiest. You don't have to spend money on it. Just the lemon water. The process makes your body more alkalized, and it's opposite of what people think about the citric juice, like the lemon juice. In the body, when it comes through the process of chemistry process, it makes body more basic.
Okay. And then somebody asked related to this, does store-bought lemon juice in a bottle work the same as fresh?
No, because they add additives, unfortunately. So you got to get, fresh lemon and squeeze it fresh. You don't have to,
Right.
yeah, the store is different. No, they add a lot of sugar, additives, and you don't know the source. So
What if it was just pure lemon juice store-bought, but does it make a difference if it's been fresh or if it's just pure, or does it matter?
better than nothing, but you can imagine in order to store juice, they add additives to it. So we want to stay away from additives and anything else.
Okay.
I mean,
Right.
yeah, it's better than nothing if you don't have access to any fruits or like lemons at
Right.
home, do that. But I would recommend the fresh because we want to stay away from additives and preservatives and all of that because unfortunately we are
Right.
bombarded by that a lot of
Right.
times in our body environment. So
Right. I wonder too if like squeezing the lemon is kind of tricky for some patients. And I don't know if you have a device of how you extract lemon from lemons that make it easier. Lemon juice. I'm sorry, from lemons.
I mean, you can squeeze it with hands. Obviously, if you can't do it because of your hand strength, you can use, whatever spoon inside and twist the spoon around. Or they sell stuff that you can, markets that you can juice the lemon by itself. Like there are different types I've seen in the market.
Got it. And then there was another question about, they asked you to please do a stretching exercise. So I know you commented that you were going to record something and give it to people later so they could see you demonstrating, but maybe you want to talk, a little bit about that.
So I can talk about my own practice. I have a yoga teacher comes to my house, and with her help, I go on the floor, and then she helps me with stretching because obviously I'm not able to do a lot of it. So we start from legs stretching. So I'm on my back, and she brings my leg up straight up in 90 degrees, and then stretches my muscles, the hamstring muscles, which is the back of the thigh. Those muscles get very tight with any type of problem, but especially with GNEM. So stretches that, and then stretches my legs to the side, and then bends my knee and stretches that, brings my bend knee to my chest and stretches. I get stretched like that, and then kind of stretches my hip too, which is like, so when my knee is bent to my chest, then she moves my knee to the side. So it's sort of like stretches my hips. And then with arms and shoulders, bringing arms up, when I'm laying position, brings my arms up and pulls on them all the way above my head. And then I turn to the side, and there's some stretching on the side. And then after that, then I go on my stomach, and still there's some stretches. I go in a cobra position. She helps me with that. So I bring my upper body up while my body is face forward to the ground. So my upper body and head comes up with her help. And then I go around my back, and then she helps me bring my hips and my legs up over my head. And these are the simple exercises, whatever that you can do. I mean, you don't have to exactly do the same way, but what I'm going to do, maybe I record one session working with her, and I'll just post it. So that way you can see it, what I do the whole, 1 hour on the floor. And if you are not able to do that on the floor, you can sit in a chair and also do stretching. One thing is really good is twisting. So you twist your body to the left and right while you put your hand against the chair, on the top of the chair, and also on the floor. Twisting is really good because twisting, you're massaging all your organs inside your body. That's very helpful. And then also the movement of your joints. She does it for me. She moves she rotates my hip joints, like my legs, and rotates it different direction, both direction. And same with arms and shoulders.
Well, it was very helpful to hear you talk through it. And I think it would be extremely helpful, as you said, to create a video so people can keep it in their library, maybe even keep it on their phone and just use it as suggested exercises. I think the stretching and the way you're doing it could be really helpful. So thank you for doing that. And we'll make sure we'll put it on our library, and we can also look at sending the link to all the people that attended today as well. Somebody asked a related question too, is how do you know when movement you're doing is too excessive? I use a cross trainer and I walk to collect my son, but worry it's too much sometimes.
For everybody is different, but when you feel extremely fatigued after a workout or exercise, and you feel like instead of having more energy, you have less energy. Obviously in the first few minutes it's normal, but if it lingers and you feel like really exhausted and tired the whole day, that means you overdid it. So you have to back off. You kind of have to be kind to your body. You don't want to, doing more vigorous exercise does not necessarily mean that your body's become healthier. So you have to back off and just do lightweight stretching, even weights, very light weights, anything you can do, but don't overdo it. Because sometimes it's irreversible once you damage the muscle.
I'm going to go to a couple of questions that went back to the food. What are your thoughts on apple cider vinegar?
I think it's great. If some people cannot tolerate it, but in the morning you got to dilute it in the water because it gets very sour and it bothers some people. But it's really healthy way. You can add, some people add honey to it for the taste, but it's very helpful as well.
Right.
That's also
Uh,
recommended.
go ahead. Sorry about that.
That's also recommended in the morning, but you can do it throughout the day as well.
Okay. And then I know dairy is not much recommended because it could cause acidity, but what about kefir?
Kefir is good. Kefir is actually, I didn't talk about this, but probiotics is also important for your gut health. So our immune system, the first line of defense in our body is gut. And a lot of people don't know that. And that means your large intestines. And we have billions of bacteria in our gut system, in our large intestines. And throughout our lifetime with stress, unhealthy food, medications, we kind of lose, and antibiotics especially, we lose some of the healthy bacteria in our gut system. So unfortunately, the bad bacteria replaces that, and that it could lead to a lot of diseases, unfortunately. You can get leaky gut syndrome, and you can, I mean, this is like another 1 hour discussion about this, but then it kind of leads to a lot of problems such as autoimmune system problems. So it's important to have, kefir has a lot of probiotics. So kefir, um, sauerkraut, probiotics by itself, they're a good source of healthy bacteria for your body. And there's like kombucha that has probiotic. There's a lot like miso paste. There's a lot in the market in US, hopefully in other countries as well. So you can take advantage of that. And it's like incorporated in your diet as well. So kefir is definitely good. However, going back, dairy, you can get kefir that is non-dairy, but in general, dairy products and gluten. Gluten is a protein found in wheat, in barley, and a lot of other like pastas. These also they cause inflammation in our body. So you want to stay away from, especially if you have sensitive stomach, if you are like having weird symptoms like bloating and getting bloated all the time and you don't know why. You start having fat around your belly even though you exercise and you're conscious of your diet. Stay away from gluten and you see a big change in your body and your gut system. So you can go gluten-free. A lot of, in US there's a lot of gluten-free bread, pasta, everything like that. And do as much as you can. Maybe in the place you are at, you don't have access to it, but just being mindful of it. And if you can
Right.
do, and also dairy product as well. So you can replace your like milk with almond milk or soy milk, and you can replace. They have all these vegan cheese and stuff like that for people. And if you can't just go off of it completely, at least decrease it so you don't have
Right.
to have it every day. So just modify.
I think for a lot of people, it's so hard to, as you said, go cold turkey. So you go gradual, you see if it makes a difference, and do it like that because it is hard. But this is, as you said earlier, it's like lifestyle changes. You kind of have to kind of think about this and kind of learn how to incorporate it. It's not easy. You said a relation to that. Do you use gluten-free barley with your lemon in the morning?
You can add that, that's fine.
But do you use gluten-free barley?
No, I just do water and lemon.
Okay. Okay, got it. I think we have one more. I just want to cover it. The guided meditation is so valuable for not just patients, but for the rest of us. Would you be willing to do just a recorded session for those of us with way too much stress and chatter?
Yes, absolutely. I can do that.
Yeah, we talked about that, about Sepideh doing a guided meditation with her own voice and kind of tailored to the GNE myopathy community. So looking forward to that. I'm looking forward to seeing your videos on modified exercise. And I also want to give a big shout out because she's actually writing a book that's going to be a great resource to patients and the community, not just people that are dealing with GNE myopathy, but anyone who's kind of managing any kind of chronic disease, that these steps can be applied to anybody who's trying to adapt different lifestyle changes to help manage their disease. So I'm excited to hear more about that book. And you gave us a really good overview to get more intrigued and excited. And again, this was incredibly, incredibly valuable. So thank you again for your time today. And thank you for all the participants for your thoughtful questions. And hope you guys found it informative. I hope I covered everything, but I think we are. If anybody has any last questions, or are we ready to? I think we got everybody. All right.
Well, thank you, everybody, and I hope that you got something out of this talk. And feel free to reach out to us if you have more questions in the future through NDF websites. All
Great.
right. Have a
Thank
great
you again. Bye, everyone.